Hello friends, welcome back to my channel. Today I am going to discuss about the NAC OSCE exam. Why we need to give the NAC OSCE even we haven't given the QE1. First of all, it will help you to be eligible for licensed clinical assistant positions in Manitoba. Secondly, if you meet all the criteria of MLP IMG program, which is also from Manitoba, you can still apply on the basis of passing your NAC OSCE without giving your QE1. I'm going to discuss what briefly the NACOSCE is. NACOSCE is basically a clinical exam, and this exam is a in-person exams, and you have 12 stations in total. That means you have 12 different rooms, which you have to go step by step. Each station will be having 11 minutes long station, and there will be a 2 minutes break, so that in that 2 minutes break you are switching from one room to another room. In the meanwhile, you have to read the statement which is written at the door. How the stations looks like, when we say stations and there's a different rooms, is just a similar like a family medicine clinic. When you go in a family medicine clinic, there are multiple rooms. Each room is having a patient and doctors is switching from one room to another room. This is the same kind of scenario happens in NACOSCE. In that room there will be a pretended patient, there will be an examiner, and you will be the third person as a candidate or as an interviewer. The most important thing which you need to understand is 12 stations are not countable in your final score. There will be 2 pilot stations, but unfortunately if we don't know which are the pilot stations, as an IMG, we have to prepare very well for all the 12 stations and perform very well in that 12 stations. One thing, between the 2 minutes break, what you gonna learn? First of all, you are exiting from one room, going and entering into the another room. In the meanwhile, there will be a problem written on the next room door, which will tell you a brief statement, which will tell you what kind of task is it, which will tell you what you have to do. Let's suppose history, physical exam, counseling, answering the questions of the examiner. They will give you a name of the patient, they will give you a gender of the patient, they will also give you the age of the patient. So make sure you just note it down, that one. So once you're going inside, you are introducing yourself to the patient, so you know to whom I'm talking about. So reading that statement in 2 minutes is very, very important. And if the only tip I would say is, if there is written that at the end examiner will ask you few questions, make sure you don't spend your whole 11 minutes on patients. Give few minutes remaining for the examiner. This is just a picture which will tell you how you will feel when you go into the exam room. So you see there are 3 peoples. One is the patient, one is the examiner, another is the candidate. You will be the person like this, switching from door to door. Each door you will have to spend 11 minutes. So you have to prepare yourself, because if someone is having a performance anxiety of something, it's very helpful that stimulating yourself how you can perform in a live scenario. Even though patients are not real, but the situation is real. Common questions ask, what are the material resources books you can use? There are multiple resources available. I would say use and stick to the one which you like the most, because NAC OSCE is all about performance and how your clinical experience looks like. It's not about from which book you are reading. If you read it one book, make sure you master that book. Your knowledge about the topic should be important, not the resource. So I'm giving you all of the names. One is the NAC, that's the OSCE and Clinical Skills Handbook by Katrina. So this book will looks like this, the first one, and the second one is the Master the NAC. This is also a very nice book. There's a third one which is Advental Manual, which is very commonly used by many people. There's a fourth one which is Objective Structured Clinical Examination Review. I personally use this book and like this book because this gives you an exact questions you need to ask in each and every scenario. There are Dr. Boston notes, which is all available all over the places on all different platforms. Toronto notes is also a good example to use when you are trying to get the knowledge of some conditions. Let's suppose if a child come with the vomiting, you have to explore there are multiple reasons of the vomit, not just the colic or not just the gastroenteritis or something happening. You have to explore more of the things. So that could be one of the things. YouTube is sometimes very, very beneficial, especially if you want to do the physical examination practice. Counseling material, I would not say I do have a specific thing for counseling, but prepare yourself for the health promotions, for the counseling stations, for the preventive medicine part. Let's suppose alcohol, let's suppose diabetes, let's suppose smoking cessations, let's suppose talking about psychiatric things. So you have to prepare for that part too. Unfortunately, there is not a one resource available for that one. What are the core subjects you're going to find out in your 11 12 station? It could be related to medicine, it could be related to surgery, it could be related to pediatrics, obstetrics, gynae, psychiatry, and the most important is preventive medicine and public health, which are basically the counseling stations. What happens is sometimes if they give you an example that you have to talk to this patients regarding diabetes, so that means 11 minutes you have to talk to the patients regarding counseling and asking the questions, making sure they understand, making sure you do a follow-ups. So all of these things comes in that. Over that time you might not experience any kind of questions from examiner. Sometimes it always depends task to task. This is very important slide from my perspective, because you need to get the best score. And how you can get the best score, these are all the competencies which you need to strengthen before you appear yourself into the exam. I have taken this from the MCC website. I would say go through and review it very thoroughly what they are exactly talking about. But in briefly, I would say first of all, they are looking for your history taking skills, which is, let's suppose if it's a pain, onset, location, duration, and other stuff you need to understand and ask. Second thing is physical examination. If the patient is complaining of abdominal pain, you're not going to do the examination of the knee joint, you have to talk about the abdominal exam. So that's the one thing you need to know. But make sure you ask for the concerns and explain the patients why you are doing it. Third thing is investigations and data interpretations. Sometimes you will get at the end a lab report, x-ray or EKG, and you have to interpret and you have to diagnose the case according to that. So let's suppose if you have 3 minutes remaining and you say, oh, I'm going to do an x-ray of this patient, then sometime examiner will hand over the x-ray to you and say, okay, can you interpret this x-ray? So you need to know how to interpret the x-ray, how to interpret the EKGs, and what are the lab findings you're looking for. Other than that, management, which could be non-pharmacological as well as pharmacological. Everybody will talk about pharma, but you have to remember about non-pharma too. Follow-ups is also one of the important things you need to know. Communication skills, very important, because this is all about talking, this is all about your life experience. So you need to do non-verbal communication as well as verbal communication. You can talk to patients about confidentiality if it's needed. You have to encourage the patient to ask you questions and other stuffs. So all of these things are very important to strengthen. How to prepare? Preparation classes, what are the things you need to do? If you want to go for the preparation classes, go for it. The only tip I would say is before you pay for any sessions, just take the demo sessions of each class from different peoples, so that you will know which person you likes and which person you want to go with. Study partner, very important for NAC OSCE, because NAC OSCE is not about reading books, it's about practicing. You can only practice if you have a live person in front of you. I would say begin as many as a study partner you can, up to 20. Literally I have done like 23 when I was preparing for my NAC, but eventually you will narrow down to 3 or 4 which you like the most and they like the most, and your time is matching. The reason for 20 why I'm saying is different backgrounds, different accents, different perspectives from each person will give you a learning experience. Initially start with 2 to 3 cases every day, read about that cases, perform those cases and see where you are, but at the end you need to do at least 8 to 10. 2 weeks before the exam, I would say take an stimulation test. That means take an 11 to 12 stations back to back like a full real mock exam. I don't know who is gonna be helping you with that, but if it's your study partner, you can do back and forth. If you are preparing for a preparation classes, they can give you, but I think if you handle that pressure from 11 stations back to back without a break, even though it's virtually, it will help you how the real exam looks like. One most important thing is when you are practicing from the day one, make sure if the task is given to you history and physical, you manage your time accordingly. If they tell you that examiner will ask you questions in the end, leave your 3 minutes from that 11 minutes. So please use the timer from the day one when you start doing preparations. Last but not the least, I would say my personal experience is NAC OSCE is all about your communication skills and your live performance. It's even more than your knowledge. Like in QE1, we have to experience more about knowledge, remembering things. but NAC OSCE is mainly about your communications and how you are handling that situation from going one station to another station with a time limit. I hope you like this video. I have given you the thorough example how the NAC OSCE exam looks like, what you have to do. If you want to know more about the NAC OSCE and if you want me to share the topics, even though there is a long list of topics, I would try to give you some of the brief overview about the topics. Please do share and subscribe to my channel and give me the comments if you have any questions from that. Thank you so much.